So in this video, we will talk about how calcium oxalate stones are formed in Crohn's disease. And so let's say we have this as a terminal ileum, and let's say this is then the cecum and the ascending colon. So what is the common location that is affected in Crohn's disease? And that should be the terminal ileum. Remember, this is really commonly affected. The most common location that is affected in Crohn's disease. So the terminal ileum is affected, and it is inflamed, and there is no absorption here, or decreased absorption. So normally what happens is that in the diet we have something called the calcium plus oxalate, or calcium oxalate complex, and normally it is kind of excreted because it is not absorbed normally, so it gets excreted in the feces. And then we also have fatty acids in the diet, and these are actually broken down or absorbed by the bile acid. But what happens in the terminal ileum normally is that there is reabsorption of bile acid. So here the bile acids are reabsorbed, but in Crohn's disease, like we said, this area is affected, and so if it is affected, the bile acid will not be reabsorbed, and they are lost. And when they are lost, fatty acids are not reabsorbed. They're not they're not broken down or reabsorbed, so they remain in the intestine. So now in Crohn's disease, bile acids are not reabsorbed, and fatty acids are not broken down. So the fatty acids are in the intestines. Calcium oxalate is also in the intestines. So what happens is that the fatty acids bind the calcium. So now, when the fatty acids bind the calcium, what is left here? Oxalate, and it is highly reabsorbed here. So oxalate is in the blood. So oxalate comes in the blood, and this blood will then go to the kidneys, where the oxalate is reabsorbed, and eventually it will form stones, calcium oxalate stones, because there's just so much that is filtered, so much of the oxalate is filtered by the kidneys that it forms the kidney stones. So this was how the calcium oxalate stones are formed in Crohn's disease.